So there are some new details that came in overnight about this hantavirus outbreak. And we also learned on Tuesday afternoon, if you haven't heard yet, that a person who lives here in Minnesota was briefly exposed to somebody who was aboard that cruise ship. I'm going to fill you in on what we know right now. On this Wednesday morning, we just heard from doctors in Paris who say that a French woman infected during the cruise is now critically ill and being treated with an artificial lung. And Spanish officials are also confirming that another passenger is now in quarantine at a military hospital, raising the total number of cases to 11. As far as the person here in Minnesota that was exposed, there is some good news. That individual has not shown any symptoms or tested positive and will continue to be monitored by Minnesota health officials. Dr. Carrie Debbink, who is a professor at Johns Hopkins University with a background in virology, spoke to KARE 11, and she says that this outbreak, despite what some people might be feeling, should not be compared to COVID-19. She says that the hantavirus is not as infectious as COVID, and she believes that the risk to the average person is extremely low, simply because the people who have tested positive for it so far are only those people that have actually been on that cruise ship. If you missed it on Tuesday, this is the full announcement from the Minnesota Department of Health. It did not give any details about where in the state this person lives, but the department also emphasizes that the risk to the public remains very low right now.